Are filler injections going to make you look puffy and pillow-faced? Hi everyone, this is Dr. Siu Takwa. Soft tissue fillers are a very popular treatment done all over the world today. The treatment involves injecting a substance, usually hyaluronic acid, to plump up sunken areas on the face and body. Fillers have gotten quite a bad reputation for themselves though. Very often when I tell my patients to consider some fillers, they will express concern about the result. They will tell me that they have a friend who has done it and everyone can tell she looks puffy. Or they will tell me about a celebrity they love who now looks very unnatural because they think that the celebrity has had fillers done. One of the most common areas where fillers are injected are the cheeks. You may have heard of apple cheeks or 苹果肌, an endearing term used to describe rounded cheeks in women which resemble apples, particularly when smiling. They are very sought after, especially in Asian cultures, as they signify youthfulness. We lose volume in the cheeks as we age, making the apple cheeks look less full. On top of that, the skin and the fat sag due to gravity, giving rise to the appearance of folds and wrinkles. When injected, fillers create volume in the cheeks, restoring the apple cheeks which time have taken away. The problem is, the area has a limited volume. Everywhere you look, you can see famous faces who are unnaturally puffed up, giving rise to the term pillow face to describe unnatural and overly plump cheeks from filler injections. So why is this happening? The problem is twofold. Number one, we are putting in too much fillers into the face. And number two, we are re-injecting the fillers too often. I want to introduce to you the concepts of visual adaptation and perception drift. Believe it or not, our concept of what is beautiful changes according to what we are exposed to. Because we are exposed to more and more exaggerated faces on platforms like Instagram, we begin to accept it as being normal or even beautiful. This is visual adaptation. At the same time, after cosmetic procedures, we forget how we used to look, and our evaluation of what we want to achieve with these procedures shift as well. We end up wanting more and more. This is perception drift. The two phenomena happen not only to patients, but also to us doctors as well, and it is very easy to get affected subconsciously. The second thing you need to know is that fillers last much longer than we previously know, sometimes even up to 10 years. Yet, many people go for re-injection of fillers every year. This frequent re-injection, combined with our errors in judgment with perception shift, are the reasons why overfilling have become more and more common. When we inject more and more product into a fixed space, the cheeks become heavier and start to sag downwards due to gravity. Very much like how breasts sag faster after breast implant surgery. Next, as the cheeks sag, folds begin to appear. In order to restore the smooth contours of the face, more fillers have to be injected, making the cheeks even heavier in a vicious cycle of filling, sagging and overfilling. I myself am not spared from making this mistake. I have overfilled my patients in the past. Fortunately, most fillers are made of hyaluronic acid, which are not permanent and get metabolized after some time. HA fillers can also be dissolved immediately with an antidote known as hyaluronidase. I want to end off by saying that despite all the bad publicity and horror stories, soft tissue fillers are an essential tool for anti-aging. The key is not to overdo it. In my opinion, it is important to look age appropriate. With modern science, we can now age gracefully. However, problems arise when we try to chase down every line and wrinkle. Remember that in the normal aging process, we should be looking less plump with age, not the other way round. Otherwise, it becomes a telltale sign that work has been done to the face.